Ooh, can I turn that light off? Yeah. There we go. We're going to try that. Okay, chapter 4. Body systems and related conditions. First definition, you need to know what is homeostasis. That is your body working at its utmost condition. It's the balance. It's for a condition in which all the body systems are working at their best. Underline that definition. To be in homeostasis, the body's metabolism, know that definition. Metabolism is a physical or chemical processes. That's just what it is. Metabolism is just the physical and chemical processes happening in your body. They must remain at a steady level to help maintain your homeostasis. Each system we're going to talk about, those are your systems 1 through 10. Each of them have unique things that they do, and they also have age-related changes that you must know, and that's what we're going to talk about mostly in this chapter. Anatomical terms of location that's in your box, those are how to describe something on a person's body. Most of the time they use it in surgeries or when we're describing where a wound is. So you need to know anterior or ventral. Ventral means the front of the body or the front of that body part that you're talking about. Posterior, of course, means back. Dorsal means back, like the dorsal fin of a fish. It's on their back. Superior, toward the head. Inferior, away from the head. Medial is midline. Just learn the key word in each. Lateral is on the side. We all actually have a state skill when they put you on their side. Lying position, when you use the pillows, it's called lateral. That's your lateral position. Proximal is closer to the torso. Just means closer to your torso. Your torso is this big part right here. Your chest and your stomach, this is your torso. And distal is farther away from your torso. That's why they call these are your digitals or digitalis. All those meaning further away. Flip to the first thing we're going to talk about is your integumentary system, which is the very, very, very important one. We talked about it a little about burn patients, how important it is to have skin. The largest organ and system in the body is your skin. Underline that. Underline that next sentence. It's a natural protective covering or integument. That's why they call it the integumentary system. It's your skin. The skin prevents injury of your internal organs. Prevents entry of bacteria. If you have breaks in that skin, then there goes a potential for a bacteria to get in there. So we're trying to stop that too. Skin is made up of layers of tissues, sebaceous glands, sweat glands. If you just look at the picture, you will not have to label anything, but I want you to know just where it's at. Those are your skin, things that's in your skin. And it's in 3 layers: epidermis, dermis, and subcutaneous. The epidermis, when you get a PPD shot, that's the tuberculin test that we'll probably have to do tomorrow. Y'all don't forget that. It goes right up on your epidermis of your skin. It's a tuberculin skin test that you have to go to the nursing home to see if you've been exposed. It's a little shot. You've never had a TB test? TB, tuberculosis? No, we'll do that. Subcutaneous skin is where we put insulin. It's just right there. And you know, have you ever seen an insulin needle? It's not very long. So your subcutaneous tissue is just right there. Your skin is very wonderful. It's there. But that subcutaneous tissue is where a lot of your medications will go. Or into your muscles. And that's what's up under your subcutaneous tissue. The skin is also a sense organ. Underline that. You feel pain, touch, pressure, heat, cold. So it makes it a sensory organ also. You have a lot of sensory receptors inside your skin. Just like when the temperature is too high, your blood vessels dilate. You ever seen, you see in white people, especially when they get hot, they turn red as beet. And it's because their blood is saying, oh Lord, they're hot. Actually, the core of their body is hot. So the blood is hopefully rushing to the outside. So you're hoping that the outside temperature is not as hot as the inside temperature. Most people's body temperature can be 96 degrees. That's what that's normal. So if it gets hotter than that, it's gonna come to the outside. And if, most of the time, it's not 96 degrees outside. So that means that blood is cooling off. That's why it opens up and dilates. Dilate means open up. And it allows the skin to let that blood actually get cooled off. That's what it's doing, because your inside is hot. So on the opposite, you wonder why you get all dry during the winter? It's your blood. Your blood says, okay, it's too cold out there, because we like 96.6. Outside, it's 40 degrees. What do you think your blood's going to retreat back to the body? So it makes your skin dry. And that's why you be dry in the winter. And that's why you need to really use lotion, because it can damage your skin. A lot of dry skin can cause cracks in your skin, which is what? An opening for bacteria. So you really need to use your lotion to keep your skin moisturized. Chapstick on your lips, all that stuff gets dry. Then you really notice it, especially when the heater's on, and it dries out the air too. Normal changes. Now this is what I want y'all to focus on. And all through every one of these systems, normal changes. The skin is thinner, drier, and more fragile. It's more easily damaged. Underlying skin is less elastic. I have somebody miss this every test. Skin is less elastic. Yeah, a lot of people think it's more elastic because of, I guess, it stretches, but elasticity means it bounces back. Remember that. Elasticity, just like a rubber band, you stretch it and pulls back, that's elasticity. For an older person, you pull it back and it's going to stay there. So that is not elasticity, that is non-elastic. Yeah. Elastic is good. We have elastic skin as we are younger. The older you get, it becomes not elastic. Underline that next one too. Protective fatty tissue is lost, so people feel more colder, and that's real. Older people are colder because they've lost a layer of that skin. It's a protective skin covering that they actually lose throughout their life, and they really do get colder, and so they really do need those layers of clothes. A lot of them, you'd be like, what in the world was it so hot in here? And that's why, because they really are colder than we are. Hair thins, turns gray, wrinkles, brown spots, liver spots appear, nails harder, more brittle, dry, itchy skin because of lack of oil from the sebaceous gland. They quit producing that good moisturizing stuff, and that's what causes wrinkles. That's what causes the non-elasticity of your skin. Older adults perspire less and do not need to bathe as often. Most elderly people generally need a complete bath only twice a week, and they do that at the nursing home. Normally it's every other day at a nursing home. But remember, somebody's got to keep track of who's bathing and when. Because you always going to have to bathe their private areas every day. I call it, you know what a bird bath is, right? The underarms, your private areas, that's really a bird bath. And every day they're going to have that. But every other day on full bath, where they're getting under the water, getting bathed.
So and, people that like stuck in bed?
Yeah. We still bathe them.
How you get
We bathe them in the bed.
Oh.
There's even a bed bath.
I thought you mean like underwater, like showers.
No, we do a tub bath. Remember modified bed bath? That's one of your skills.
Mm-hmm.
That's how we bathe them in the bed. They only show you the eyes and the arm because you use those same principles throughout the whole thing. The long strokes of the arm and the long strokes on the leg. Same with the long strokes on the back. Anytime because you want to bring all the bacteria away from the body. So the long strokes is how you clean all the body parts. So once you get that arm, you apply that to the rest of the body. And then y'all also did perineal care, which is your private areas. So that's the body. That's the whole body. You got it. Also underline that last sentence in the orange box. Well, next to the last. The NA should not cut residents' toenails. Do not cut their toenails. That is a law, not really. But you do not cut people's toenails. I don't cut people's toenails. I send them to the podiatrist. Because if I mess them up and say they have diabetes, we already know diabetes people do not heal well. And what if I give them some kind of cut or hurt their skin some kind of way? And it's their toe. And all that bad circulation going on, that
So,
can make them lose their toes.
so that's why some diabetes have to go to the doctor.
Foot
to get
doctor.
those quick.
Yes, ma'am. That's
Yeah,
why.
My grandma used to.
Yeah, because we got to watch that, because that is no joke. They're very, very, very susceptible to losing toes because of the bad circulation that diabetes causes. And just the sugar that's in their system won't let the good stuff get to that wound, if they do get a wound. So you let a doctor do it. Okay? I don't even do it. So don't y'all be cutting people's toenails. Okay? Observe and report for the integumentary system. These are things you need to go tell the nurse, or report, or chart. However you're going to do it, that somebody else is going to look at it. That's what you do. Pale, white, red, and or purple areas. What could that mean? A bruise, or no blood circulation. Something's happening that they're not getting circulation right there. A lot of times that's the beginning of a pressure ulcer. So once you see that going on, you do not let that ride. You let